Hi, good evening all. So now we can discuss anatomy and physiology MCQ or model questions of anatomy and physiology. So let us discuss one by one here. The first question, haloenzyme is made up of. Haloenzyme is made up of apoenzyme and zymosin, apoenzyme and coenzyme, coenzyme and prosthetic group and cofactor. So now we are discussing MCQ of anatomy and physiology. So let us discuss first question. Haloenzyme is made up of apoenzyme and zymosin, apoenzyme and coenzyme, coenzyme and prosthetic group and cofactor. The answer is B, apoenzyme and coenzyme. Then next question, which of the organelle is called suicidal bag? Which of the organelle is called suicidal bag? Which of the organelle is called suicidal bag? Mitochondria, endoplasmic reticulum, lysosome and ribosome. Which of the following organelle is called suicidal bag? Mitochondria, endoplasmic reticulum, lysosome, ribosome. And the answer is C, lysosome. Then next question, most abundant blood cell in the human body are. Most abundant blood cell in the human body are. Most abundant blood cells in the human body are WBC, RBC, platelets, plasma cells. WBC, RBC, platelets, plasma cells. And the answer is B, RBCs. The next question, number of iron atoms in one hemoglobin molecule are. Number of iron atoms in one hemoglobin molecule are. Option A 1, B 3, C 4, D 8. Number of iron atoms in one hemoglobin molecule are 1, 3, 4, 8. The answer is C 4. The next question, which of the following is not a coenzyme? Which of the following is not a coenzyme? Which of the following is not a coenzyme? The answer is D, is not a coenzyme. The next one, second question, activity of allosteric enzymes are influenced by. Activity of allosteric enzymes are influenced by allosteric modulators, allosteric site, catalytic site, none of above. And the answer is allosteric modulators. The next question, in competitive inhibition, inhibitors bears a close texture similarity with the. In competitive inhibition, inhibitors bear a close textural similarity with the coenzyme, cofactor, prosthetic group, substrate. The answer is D. Then the next question, enzyme acts best at a particular temperature called. Enzyme acts best at a particular temperature called. Catalytic temperature, at normal body temperature, optimum temperature, none of the above. Enzyme acts best at the particular temperature called. Catalytic temperature, at normal body temperature, optimum temperature, none of the above. And the answer is C, optimum temperature. The next question, lock and key model is known as. Lock and key model is known as. Lock and key model is known as template model, induced fit model, Costlands model, enzyme substrate interaction. The answer is A, template model. The next question, which bond is not associated with enzyme substrate interaction? Which bond is not associated with enzyme substrate interaction? Hydrogen bond, ionic bond, disulfide bond, van der Waals force of. The answer is C, disulfide bonds. Then, which of the following statement is incorrect here? Which of the following statement is incorrect? Enzymes are protein nature, enzymes are colloidal in nature, enzymes are thermolabile, enzymes are inorganic catalyst. Enzymes are protein in nature, enzymes are colloidal in nature, enzymes are thermolabile, enzymes are inorganic catalyst. The answer is D, enzymes are inorganic catalyst. The next one, apoenzymes. Apoenzyme dissociated from coenzymes due to. Apoenzyme dissociate from coenzyme due to change in pH, change in temperature, change in substrate contraction, change in inhibitor concentration. Change in pH, change in temperature, change in substrate concentration, change in inhibitor concentration. And the answer is A, change in pH. The next question, which of the enzyme inhibition shows decreased Km value? Which of the following enzyme inhibitor shows decreased Km value? Competitive inhibition, uncompetitive inhibition, non-competitive inhibition, feedback inhibition. The answer is A, competitive inhibition. The next question, total amount of total blood volume in an individual is approximately. Total amount of total blood volume in an individual is approximately 50 ml per kg body weight, 60 ml per kg body weight, 90 ml per kg body weight, 80 ml per kg body weight. Amount of total blood volume in an individual is approximately. The answer is D, 80 ml per kg body weight. The next question, normal blood pH is. Normal blood pH is. Normal blood pH is 7.3, option B 7.2, 7.4, 8.4. The answer is C, 7.4. Then hematocrit value is ratio of. Hematocrit value is the ratio of WBC to plasma, platelets to plasma, RBC to plasma, total blood cells to plasma. Hematocrit value is the ratio of. Hematocrit is the value ratio of. Hematocrit value is the ratio of. Here the answer is C, RBCs to plasma. Then plasma represent dash percentage of total blood value. Plasma represent dash percentage of total blood value. Plasma represent dash percentage of total blood volume. 35, 45, 55, 5. 35, 45, 55, 5. The question number 17. Answer C, 55. The next question, normal amount of plasma protein ranges from. Normal amount of Plasma protein ranges from 2.2 to 4.3 gram per cent, 4.4 to 6.3, 6.4 to 8.3, 8.4 to 10.2 grams per cent. And the answer is A, 2.2 to 4.3. Then next question, which component? The next question you can see, which component of protein? 19th question, right? Okay, so which component of protein, here you can see which component of protein contribute maximum percentage to total plasma protein? Which component of protein contribute to maximum percentage to total plasma protein? A, albumin, B, globulin, fibrogen, prothrombin. And the answer is A, albumin. The next question, serum doesn't contain calcium, prothrombin, factor 8, factor 10. Serum doesn't contain calcium, prothrombin, factor 8, factor 10. And the answer is calcium. Serum doesn't contain calcium. The next question, combination of heme with O2 is called. Combination of heme with O2 is called oxyhemoglobin, oxidation, oxygenation, oxidized hemoglobin. Oxyhemoglobin, oxidation, oxygenation, oxidized hemoglobin. The 21st question, the answer is A, oxyhemoglobin. The next question, adult hemoglobin contains dash polypeptide chains. Adult hemoglobin contains dash polypeptide chains. 2 alpha, 2 gamma. Option B, 2 alpha, 2 beta. 2 alpha, 2 gamma, 2 beta, 2 gamma. The B, 2 alpha, 2 beta. The next question, each hemoglobin molecules carry dash number of O2 molecules. Each hemoglobin molecules carries dash number of O2 molecules. Each hemoglobin molecules carry dash number of O2 molecules. Each hemoglobin molecules carry dash number of O2 molecules 2, 4, 1, 8. The answer is D. Each hemoglobin molecules carry dash number of O2 molecules. Answer B. The next question, each gram percentage of hemoglobin when fully saturated can carry. Each gram percentage of hemoglobin when fully saturated can carry. Okay, the next question, (23rd question). We have completed 23rd question. The next question, 24th question. question. Sorry for disturbance. Okay, 24th question. Okay, each gram percentage of hemoglobin when fully saturated can carry. Option A 1.534 milliliter. Option B 3.14 milliliter. Then option C 4.13 milliliter. D 5 milliliters. Each gram of hemoglobin when fully saturated can carry 1.34 milliliter, 3.14 milliliter, 4.13 milliliter, 5 milliliters. The answer is B 3.14 milliliters. The next one, in sickle cell anemia, the defect lies in which polypeptide? In sickle cell anemia, the defect lies in which polypeptide? Alpha chain, beta chain, gamma chain, delta chain. In sickle cell anemia, defect lies in which polypeptide? Alpha chain, beta chain, gamma chain, delta chain. The answer is B, beta chain. The next question, average mean corpuscular diameter is dash. Average mean corpuscle diameter is 5.5, 5.1, 6.3, 7.3, 8.5. Then the answer is C. The next question, increase in RBC count beyond 10 million per cubic millimeter is known as. Increase in RBC beyond 10 million per cubic millimeter is known as anisocytosis, poikilocytosis, polycythemia, leukocytosis. The answer is C, polycythemia. The next one, during electrophoresis, hemoglobin first appears in. During electrophoresis, hemoglobin first appears in. During electrophoresis, hemoglobin first appears in early normoblast, options you can see, intermediate normoblast, late normoblast, pronormoblast. During erythropoiesis, hemoglobin first appears in early normoblast, intermediate normoblast, late normoblast, pronormoblast. And the answer is B, intermediate normoblast. The next question, during hypoxia, kidney releases. During hypoxia, kidney releases renin, renal erythropoietic factor, erythropoietin, none of the above. During hypoxia, kidney releases renin, renal erythropoietic factor, erythropoietin, none of the above. And the answer is B, renal erythropoietic factor. The next question, intrinsic factor is secreted by. Intrinsic factor secreted by liver, chief cells of stomach, parietal cells of stomach, beta cells of pancreas. Intrinsic factor is secreted by liver, chief cells of stomach, parietal cells of stomach, beta cells of pancreas. The answer is C, parietal cells of stomach. Then next one, which of the following extrinsic factor is required for maturation of RBC? Which of the following extrinsic factor is required for maturation of RBC? Vitamin B12, folic acid, iron, both A and B. 31st question. Which of the following extrinsic factor is required for the maturation of RBC? 31st question. The answer, vitamin B12 and folic acid. Option D is the correct answer. The next one, largest WBC in peripheral blood is? Largest WBCs in peripheral blood is neutrophil, large lymphocyte, monocyte, eosinophil. Neutrophil, large lymphocyte, monocyte, eosinophil. Largest WBC in peripheral blood is? The answer is C, monocyte. The next one, the process by which WBC squeeze through pores in capillary wall is? The process by which WBC squeeze through pores in capillary wall is? Chemotaxis, pinocytosis, opsonization, diapedisis. Diapedisis. The process by which WBC squeeze through pores in capillary wall is? Chemotaxis, pinocytosis, opsonization, diapedisis. The answer is D, diapedisis. The smallest blood cell is? Smallest blood cell is small lymphocyte, platelet, RBC, neutrophil. Smallest blood cell is small lymphocyte, platelet, RBC, neutrophil. The answer is B, platelet. The next question, common anemia in India is? Commonest anemia in India is? Pernicious anemia, sickle cell anemia, iron deficiency anemia, none of the above. Common anemia in India is pernicious anemia, then sickle cell anemia, iron deficiency anemia, none of the above. The correct answer is iron deficiency anemia. Common anemia in India is? Common anemia in India is? The answer C, iron deficiency anemia. Then next question, the term endoplasmic reticulum was coined by? The term endoplasmic reticulum was coined by Camillo Golgi, Porter, Robert Brown, Benda. The term endoplasmic reticulum coined by Camillo Golgi, Porter, Robert Brown, Benda. The answer is B, Porter. The next one, which of the following organelle has a continuous connection with the nuclear membrane? Which of the following organelle has continuous connection with the nuclear membrane? Golgi apparatus, lysosome, rough endoplasmic reticulum, smooth endoplasmic reticulum. Golgi apparatus, lysosome, rough endoplasmic reticulum, smooth endoplasmic reticulum. Answer C, rough endoplasmic reticulum. Then in rough endoplasmic reticulum, ribosomes are located on? In rough endoplasmic reticulum, ribosomes are located on? At cytoplasmic side, on the luminal side, both A and B, all throughout. Cytoplasmic side, on the luminal side, both A and B, all throughout. The answer is A, the cytoplasmic side. The next question, which of the following statement were true regarding endoplasmic reticulum? Which of the following statement were true regarding endoplasmic reticulum? ER provides structural framework to the cell. B, ER acts as an intracellular transporting system. And C, smooth endoplasmic reticulum is involved in SCR, involved in synthesis of lipids. All of the above. The answer is D, all of the above. The functions of ER is provide structural framework to cell, as well as it acts as intracellular transporting system, and not only that, it involves in the synthesis of lipids. The next question. Let's see here. Which of the following statements are correct regarding Golgi operators? Which of the following statements are correct regarding Golgi operators? Sorting and packing, exocytosis of melanin granules, exocytosis of thyroxine hormone, all the above. Which of the following statement correct regarding Golgi operators? The answer is D, all of the above. The functions of Golgi operators are sorting and packing, exocytosis of melanin granules, exocytosis of thyroxine hormone. Then next, the term Golgi operators coined by. The term Golgi operators coined by. The term Golgi operators coined by. Camillo Golgi, Robert Brown, Robert Hooke, Benda. Name itself it has Camillo Golgi. The next one, F0, F1 particles are located on. F0, F1 particles are located on thylakoids, inner mitochondrial membrane, Golgian vacuoles, none of the above. None of the above. The answer is B, inner mitochondrial membrane. The next one. Next question. In mitochondria, cristae act as sites for. In mitochondria, cristae acts as site for protein synthesis, phosphorylation of flavoproteins, breakdown of micromolecules, oxidation reduction reaction. The answer is D, oxidation reduction reaction. The next one, mitochondrial inner membrane is rich in which phospholipid? Mitochondrial inner membrane is rich in which phospholipid? Sorry for the disturbance. So mitochondrial inner membrane is rich in which phospholipid? Mitochondrial inner membrane rich in which phospholipid? Phosphatidyl inositol, then phosphorylserine, cardiolipin, phosphatidylcholine. The answer is C, cardiolipin. Then, which of the following is not a function of mitochondria? Which of the following is not a function of mitochondria? Electron transport and associated ATP production, fatty acid breakdown, non-shivering thermogenesis, glycolysis and associated ATP production. The answer is D. Glycolysis and associated ATP production. Then, who coined the term mitochondria? Who coined the term mitochondria? Who coined the term mitochondria? Colliker, Benda, Fleming, Robert Brown. Robert Brown. The answer is B. Bend. Then next one, nucleus was first discovered by. Nucleus was first discovered by Robert Hooke, Strasburger, Robert Brown, none of the above. Nucleus was first discovered by Robert Hooke, Strasburger, Robert Brown, none of the above. The answer is Robert Brown. The next one, nuclear membrane is in continuous connection with. Nuclear membrane is in continuous connection with smooth endoplasmic reticulum, rough endoplasmic reticulum, Golgi apparatus, lysosome. Smooth endoplasmic reticulum, rough endoplasmic reticulum, Golgi apparatus, lysosome. The answer is rough endoplasmic reticulum. The next, the number of nuclear pores depends on. The number of nuclear pores depends on size of cell, transcriptional activity of the cell, DNA content of the cell, all of the above. The answer is B, transcriptional activity of cell. The next question, the DNA protein ratio in chromatin is. The DNA protein ratio in chromatin is 3:1, 2:1, 1:1, 4:1. The DNA protein ratio in chromatin is 3:1, 2:1, 1:1, 4:1. The answer is C, 1:1. So thank you all. So up to now we have discussed 50 MCQ of anatomy and physiology. So in the next video, I tell you next 50 questions of anatomy. Thank you.